back to my YouTube channel. If you're here for the first time, hi, my name is Busari Molayo and I'm a registered nurse based in Nigeria. On this channel I film about nursing and healthcare. In today's video we're going to be learning about pre and post-operative nursing care plan. If you're new here and you've not watched my video on nursing care plan, I'm going to link it up here so that you can watch it later on. But today we're going to be focusing majorly on pre and post-operative nursing care plan. Now, this is something that you might come across in your nursing and midwifery council examinations, because if you have a question on surgery, then definitely you're going to be having a care plan coming on pre-operative and post-operative nursing care plan. And most times they'll be like, solve 1 pre-operative diagnosis and 2 post-operative diagnosis. Now, so that you don't beat around the bush or you get confused when you're told to solve this particular type of care plan, I'm going to be giving us general nurse diagnosis that will work for almost all, if not all, conditions in nursing. So the first are the pre-operative diagnosis, which is 1, anxiety. Why would anxiety be like a general nursing diagnosis? Because everybody that is going for a surgery is going to be anxious, because especially here in Africa, we have this notion that surgery is a bad thing and the person has a tendency of dying or this or that. There are so many religious orientations that negate surgery basically. So definitely anyone that wants to go for surgery would be anxious. So anxiety related to possibly cost of the surgery, uncertainty about prognosis of the surgery, unfamiliarity with the surgery, or in fact religious beliefs related to the on surgery basically are things that could actually cause anxiety for a patient. And what would be your evidence for anxiety? The patient may be not willing to cooperate, the patient may be scared, the pulse of the patient may rise, the patient may be sweating, the facial expression and all would actually be evidence pointing towards the fact that this patient that is about to go for surgery is anxious. You understand? So definitely anxiety is one of the things you can solve. And how would you do this? Definitely you have to assess the level of anxiety or the cause of anxiety. You allow the patient to ask questions that they want to ask. You then answer all the questions the patients have asked. You make sure you reduce medical terms when you are doing this so that the patients can understand. Another thing is that you reassure the patients and offer psychological support. These are interventions that you can use to solve anxiety. Now moving to post-operative nursing diagnosis, usually the ones that are general that would work for almost any surgery. The first one is pain. Obviously, someone that has gone into the theater and come out, there has been an incision done, which is not the way the body was normally. So definitely there will be pain because of that surgical incision. So definitely pain is one thing you would have. Another thing you would have when the person is coming out is risk for infection. Risk for infection because there has been an incision made, so definitely the skin barrier has been damaged or has been messed with or has been tampered with. So at that point there's risk for infection, because the skin is one of the things that helps to prevent microbes or microorganisms generally from the external environment from getting into the visceral organs. So once that part has been incised or an incision has been made, there is a high risk for infection. So that is a second nursing diagnosis that you could work on for post-operative. Then another thing, depending on the site or the type of surgery now this time around, is imbalanced respiration. Now if the person has been placed under anesthesia, most times general anesthesia, the person's respiration is going to be depressed, like it's going to be abnormal. So those are 3 post-operative diagnoses that most times are general to all nursing diagnoses. Now I spoke about acute pain. How are you going to solve acute pain? I mean the nursing interventions for acute pain. Definitely you want to assess the level of pain, you want to place the patient comfortably on the bed, you want to offer psychological support, diversional therapy, everything related to pain management. Then lastly you have to administer prescribed analgesics. Most times they give them some opioid analgesic like pentazocine. They could give them paracetamol injection or any other thing that could be given to a patient to mask the pain from the surgical incision. That is for pain. The another thing I mentioned is risk for infection, which is general to everybody that has gone through surgery or just coming out from the theater. So you're going to make sure that you assess the sites for any sign of infection. That's one thing you want to do. Another thing is you want to maintain aseptic techniques when cleaning the wound. Then you make sure you dress the wound regularly. If you're supposed to dress the wound daily, then you do the daily dressing. If it's like alternate days, like you dress today, next 3 days and all, then you dress accordingly. Another thing is you have to administer the prescribed antibiotics given to the patient. I hope you guys are following. Then the third thing that I mentioned was imbalanced respiration. To manage that, the first thing you want to do is to assess the patient's respiration, and you can do that, the same way you check respiration with vital signs. Yes, so you count the patient's respiration to check for abnormalities possibly, and you try to like listen. Is the respiration, is the person struggling to breathe, is there an abnormal sound coming with the respiration and all that? You check for that. You administer any drug that has been given, possibly to clear up the airway. So before administering drug, most times I advise you put your drug administration as the last intervention, because it is an interdependent role of interdependent or dependent now. Yeah, dependent, because you have to wait for the physician to prescribe before you administer, basically. Then you have to before the admission, basically you have to put the person in semi-phallus position, like the person has to sit up to help the diaphragm to relax and create more space in the thorax for the person to breathe. If the person has any tight clothing on, you have to remove it. Then you have to make sure that the place the patient is placed is somewhere that is well ventilated, you understand? If the windows are closed, you open them. If the fan is not on, that's if the environment is not too cold, you get. So you have to make sure that the area is well ventilated. Then if the person is to be placed on oxygen, you can administer prescribed oxygen. If the person is placed on any mucolytics or anything, then you administer the drug. So I hope you guys were able to pick one or two things from all I've said today. You can use any of these diagnoses that I've mentioned basically to solve your pre and postoperative nursing care plan during your exam, guys. So if you want me to do more nursing care plan videos, or you have nursing care plan videos that you want me to film, kindly leave them in the comment section. Like this video, share to your friends, and don't forget to subscribe. Till next time, guys, bye bye.